Dr. Fauci, would you like to at least answer this one question for us today and let us know whether or not you've changed your mind on whether or not the benefits of gain-of-function research outweigh the risks?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
The chairman has denied your assertion of privilege and directed you to answer, but you nonetheless refuse and stand on privilege despite the existence of the pardon. The committee will have to consider after this hearing what appropriate action should be taken against you for the failure to testify after being directed to do so. It's against the law to obstruct an investigation of Congress. There will be repercussions to your refusal to testify today. Senator Peters. You're not recognized. You're not recognized. If you are unruly, you will be removed from the proceeding. You are not recognized, and you are not recognized, sir. Sir, you are not recognized. You are not recognized. Security, we'll hold off. But you will respect these proceedings. You were told not to sit at the table. You insist on sitting at the table, and we told you you would not be recognized. You are not invited here for testimony, sir. You are being disruptive. Would you behave this way in a courtroom? No, because the judge would put you in jail. I can't do that today, but I can have you escorted from the premises. So I would say, sir, sit quietly and don't say another word. I said, sit quietly, you are not recognized. Another word and you're gone.
So, Mr. Chairman, I'd like to hear what the attorney has to say.
He is not recognized by the committee or the chair. If he speaks again, he will be removed from the room. This testimony is from Anthony Fauci. This is not a game with his lawyers. He can advise, his lawyers can give him advice. He's got a half dozen here. They're all allowed to talk to him.
Yes.
All right? Yeah. But the attorneys are not recognized. In fact, the attorney was told not to sit at the table, and he's not obeying that recommendation. There's a row behind you, sir. That's where you were told to sit, and you're not. And now you're disrupting the proceedings. And so, look, this is the way Anthony Fauci wants to be remembered, for a lawyer not listening to the rules. That's the way you want to be remembered, and that's what you're going to do. You are not recognized, sir. Security, please remove him from the room.
I just go into your...
Let the record state that Dr. Fauci will still have the advice of the other half a dozen attorneys that he brought along today. Senator Peters.
Thank you, Mr. Chairman. The COVID-19 pandemic is not the first or the last public health crisis to impact our nation. In December 2022, I released a report that identified significant failures in our federal government's preparedness and initial response to COVID-19. This report contained 17 key findings. It's a very large report, which I have right here. It contains 17 key findings and corresponding recommendations, including the need to invest in sustainable domestic manufacturing capabilities for critical medical supplies, build the infrastructure needed to surge testing capacity for infectious diseases, and robustly fund public health emergency preparedness and responses across all levels of government. Unfortunately, multiple administrations, including the current Trump administration, have failed to fund or to reform our health preparedness. This is something that I would hope the committee in the future would investigate. It needs to be taken a look at. It also feels like a new public health threat is hitting us every month. There's a foodborne parasite affecting thousands of people in Michigan and across the country, and our federal agencies still haven't fully pinned down the source of that outbreak. Measles cases in this country are at the highest they've been in 35 years. More children are getting sick and even hospitalized from this preventable disease. Over 1,000 people have died from the Ebola virus in Africa, and we don't know how widespread this crisis actually is. We have a hantavirus scare on a cruise ship, and though it hasn't made headlines in the way that the screwworm threatening our food security has, I remain concerned about bird flu that is also spreading and could one day cause a pandemic. This is also something this committee should be investigating and holding hearings on. Since January 2025, the Trump administration has taken a number of actions to drastically weaken our ability to fight infectious diseases and biological threats that endanger Americans. These actions are both incomprehensible and are also inexcusable. They include slashing funding for public health and infectious disease research, canceling contracts for cutting-edge vaccine technology, shutting agencies responsible for tackling infectious diseases around the world, firing thousands of federal employees with keeping our communities and our medicines and our food supply safe, and injecting political appointees in what should be non-political grant-making functions. That is something this committee should be looking at. I could go on. I could go on all the topics that we need to be looking at moving forward to protect this country. We're not doing that in this committee. That's what this committee was designed to do. It's what it has done throughout history. It has done it in a bipartisan way. We should get back to that and think about the future of this country and keeping this country safe. When a crisis like COVID-19 strikes, we have an obligation to examine what went right and what went wrong to provide accountability for the American people. Congress certainly has done that. Between the House and Senate, nearly 20 different committees, including this committee, as I mentioned, have conducted oversight of the COVID-19 pandemic, conducting transcribed interviews, holding dozens of hearings, and released more than 10 reports. Today's exercise, unfortunately, is a stark departure from those largely bipartisan, legitimate efforts. The chairman has shut the minority out of participating equally in these efforts, withheld information, selectively released documents, actions that completely undermine the credibility of this investigation. I will enter a record without objection, Mr. Chairman, a letter that I sent to you that detailed all of those areas that we have concern with and where we were shut out.
Without objection.
We'll provide other details as well. I think today's hearing, unfortunately, does real damage. It's tempting to turn one person into the scapegoat for a crisis that hundreds of officials across both the Trump and the Biden administration were responsible for handling. And it does so in a way that people that are facing death threats. This is only going to, unfortunately, deter other scientific experts from public service to understand that this is what they would have to go through as they provide their advice to us. We're not going to make our nation safer, and I hope that we can restore by doing these kinds of activities, and I hope that we can restore our legitimate bipartisan oversight that's going to help strengthen our public health and pandemic preparedness and other homeland priorities. That's what this committee needs to focus on. It hasn't the last year and a half. Let's hope it does in the future. Thank you, Mr. Chairman.
Senator Johnson.
Thank you, Mr. Chairman. Dr. Fauci, I hope the American people listen very carefully to Chairman Paul's opening statement. I think it's a stunning indictment of the actions you've taken that have been so destructive to global health. I certainly understand why you needed a pardon. I certainly understand why, on the advice of counsel, you're not answering any questions, because I think it would be almost impossible for you to answer the questions truthfully without really demonstrating what you did, your culpability, self-incriminating. We have, all of us, has prepared a lot. I've been deluged with questions to ask Dr. Anthony Fauci. There are so many legitimate questions that deserve answers, and now you're not willing to provide them.
If you like this video, then like, share, and subscribe to Mirror Now.